The White House had initially proposed COVID-19 booster shots would be offered starting September 20th. That's 1 week from today. But two key advisory committees must first meet before it's determined if and when booster shots will be available for the general public. So joining us now is our chief health editor, Dr. Partha Nandi. Dr. Nandi, who are the two advisory committees and when can we expect some answers?
So Glenn, it's really up to the FDA and the CDC to determine the specifics regarding these booster shots. The first committee, or the first meeting rather, is scheduled this Friday, and it's the FDA's Vaccines and Related Biological Products Advisory Committee. Now, this group of independent medical experts are going to scrutinize the data, make sure that a third dose is not only safe but also effective. After that, the CDC's committee will meet. The job of the advisory committee on immunization practices there is to make recommendations regarding who should get the vaccine and when. There's no date scheduled yet for this meeting, but I expect it'll be on the heels of the FDA's meeting. Now, both of the scientific advisory committee's decisions will be based on the current data, which should tell us if everyone needs a booster shot or maybe just the elderly or another group. Now, if we need to wait 6 months or 8, or maybe even longer, I expect that we'll have answers about this and regarding boosters in about a week's time.
So, Dr. Nandi, some scientists, including two FDA leaders, say the evidence shows that COVID-19 vaccines don't currently need a booster shot. What's your opinion about that?
Yeah, it's a little confusing now, isn't it? So the reason why boosters are being considered is based on research that shows that the efficacy, the effectiveness of the COVID-19 vaccines go down, reduce, wane over time. But now there's a new published paper that found that vaccines continue to be substantially protective when it comes to two things: severe disease and hospitalizations. And this paper concluded that most folks do not need a booster, with the possible exception of those who have weakened immune systems. This is a new paper. And yes, two of the authors on this paper are senior FDA vaccine leaders. They were part of an international group of vaccine scientists that analyzed several trials and studies. Now, on the flip side, there's always a flip side, is Israeli data that shows that the Pfizer's booster had a dramatic impact. And here's what happened. Israel started their booster program August 1st. And so far, the data shows that the risk of severe disease decreased more than 10 times, and the risk of infection decreased more than 11 times. Again, very compelling. So what are we supposed to make of all this information? Bottom line is that, number one, our vaccines work, and it's possible that they'll work even better with boosters. I support and believe both the FDA and the CDC, and I know they'll look at the information very closely at the current data and make the best decision regarding boosters for Americans and the American public. So we have to wait and see what they say. But I think there's some merit on both sides. You got to see where the information comes out to. But bottom line is vaccines work, and that's the way to get out of this pandemic.
So all of us learning and gathering information as we go. Dr. Nandi, thank you so much for the update.
My pleasure.
Millions